This is a pelvis and perineum tutorial presented by the SHLDB with reference Great Atlas of Anatomy by Richard L. Drake, A. Waynes, Vordum, Adams Mitchell, Richard Tibbit, Paul Richardson, and Ansel Holm. Hello. In this tutorial, we're going to see the pelvis and perineum in anatomy. So now, in order to visualize the pelvis and perineum, we first need to visualize the surface anatomy of the pelvis. So this is the pelvis in a typical male. Here's the umbilicus. In the surface anatomical region, here you can visualize a small bone here, the anterior superior iliac spine. Here you are going to have the pubic tubercle. Here you are going to have the scrotum. Here is the glans of the penis. At this location here, when you go deeply, you're going to have the inferior pubic ramus. You're going to have the ramus of the ischium. You have the obturator foramen. We have at this position here the pubic tubercle. You have at this position the inguinal ligament. You have the anterior inferior iliac spine, and here the anterior superior iliac spine. Now looking at the bone, this is the pelvic girdle. The pelvic girdle is made up of the two pelvic bones. So now, a pelvic bone. This is the pelvic. The hip bone consists of the pelvic bone consists of two main bones. You have the sacrum and the hip bone, and the hip bone constitutes of three bones which are fused. At this portion here, you have the ilium. At this portion here, you have the pubis, and at this portion here, you have the ischium. So the ilium has different parts. These are the parts of the ilium. You have the iliac fossa, you have the iliac crest. The iliac crest have different lips. You have the medial, the lateral lip, and the intermediate lip. So these are the different parts of the ilium. At this position here, anterior to the crest of ilium, you have the anterior superior iliac spine, and here inferior, you have the anterior inferior iliac spine. Now, on the ischium, this is the other bone here, is going to be called the ischium. All of them are going to form the acetabulum, where the head of the femur is going to articulate. Now, posteriorly here, you see that the ischium has a posterior side, as you're going to see in the diagram below here. But here, visualizing anteriorly, you can visualize the pubis, and the pubis has a superior ramus with an inferior ramus which is going to bind with the ischium. The superior ramus is going to bind with the arcuate eminence from the ilium. So you are going to have an arcuate eminence from the ilium with the superior ramus of the ilium. That line that is formed from the combination of the arcuate eminence and the pubic superior ramus is going to be called the pectineal line, and the pecten. So that pectineal line is going to be and now going above that line, above at this position here, you're going to have the arcuate line. Inferiorly here, you have the pectineal line. So the what origin from the pectineal lines is the pectineus muscle. So this is what you can visualize from this diagram, and medially here we have the pubic symphysis. Now here is the sacrum. The sacrum is characterized by here having this position here which articulates with the lumbar vertebrae 5. This is the sacral promontory here. Here are the different anterior sacral foraminals. So as you can see posteriorly, you are going to see also the posterior sacral foraminals. The difference between the sacrum is that, and the other vertebrae, is that all the other vertebrae only have one intervertebral foramina, while in this case of the sacrum, it has the intervertebral foramina are divided into the anterior sacral foraminals and the posterior sacral foraminals. At this inferior part here, you are going to have the coccyx. So now here above here is going to be the pelvic inlet. So you're going to have a pelvic inlet here with the difference in male pubic and bone. You see that the male pubic bone is much more roughened compared to the female pubic bone, and also the pelvic inlet is going to be smaller. See how the pelvic inlet is very small. We're characterized by having the arcuate line laterally and the pectineal line anteriorly with the pubis here. So posteriorly you have the ala of the sacrum. at the rims, the different boundaries of the pelvic inlet. So at this subpubic angle, for males, you realize that the subpubic angle is going to be very small, and it is characterized by having 2-digit fingers, your middle finger and your index finger open as such. So the angle is going to be 50 to 60 degrees in men, the subpubic angle. Now let's visualize the posterior side. So now in the posterior side, you realize that you have the sacrum, you have the ala here, and now this part of the ala now is no more the iliac fossa but the gluteal surface of the ilium. Here's the crest. Now in here posteriorly, we mostly see now the ischium. The ischium at this posterior side, this is the body of the ischium. The body of the ischium is going to have at this superior side here the spine of the ischium, the superior side here, and this inferior side is going to have the tuberosity of the ischium, called the ischial tuberosity. Now the superior ramus of the pubis and the inferior ramus of pubis, all with the ischium, is capable of is going to form now this foramen here. This is going to be called the obturator foramen. Here we are going to have the pubis symphysis. Posterior, you can see the coccyx, and here you can see the sacrum. The sacrum is characterized by having posterior sacral foramina, and you have here the medial ridge, the intermediate ridge, and the lateral ridge. The medial ridge is formed by the combination of all the different spines from the first sacrum to the last sacral bone. There are 5 sacral bones. All the spine combine to form the medial ridge. We have the intermediate ridge, which is formed by the combination of the sacral superior and inferior articulating facet. And we also have the lateral ridge, which is formed by the combination of the transverse process of the sacrum. So all these are going to account for the body of the sacral bone. Here you have the superior articulating facet which is going to articulate now with the inferior articular process of the L5 bone. So now in the female, we have this surface anatomy. Here is a pubic tubercle. Here is a anterior superior iliac spine. Here you are going to have umbilicus. Here you are iliac crest. Here you are anterior superior iliac spine when it's found with the bone shown below. Here you have the inguinal ligament binding the anterior superior iliac spine with the pubic tubercle. Here you are going to have the anterior inferior iliac spine. You have the anterior inferior iliac spine at this position. Here you are going to have the pubic tubercle, the obturator foramen, the ischial ramus, and the inferior pubic ramus. Now this is a typical pelvic bone in a female. In the female, you see that the inlet is much more higher. We see that there are different lines now involved with the pelvic inlet. We have this anteroposterior line, we have this transverse line, and we also have this line here called the oblique line. So this line here is the anteroposterior line. You see that it is much more larger. The largest line here in females is going to be the transverse line, which is from this ischial spine to this other ischial spine here. We also have the anteroposterior line here. So these are the different lines. I also have an oblique line from this junction here between the ilium and to another ischial spine here. So now this diameter from here to here is going to be the diameter from this position to this position is going to be 12 centimeters in females. So it ranges from 11.5 to 12 centimeters, and the more you are going towards this position, the more you are adding 0.5. So this is 11. This is 11.5 and this is 12.5 in males. In males, here it's 11, the 11.5, and then 12.5. And now in female, mostly it's going to start from 12.5, and here is mostly 13 centimeters with a subpubic angle of 80 to 85 degrees in men, associated with opening the index finger and the thumb. So anteriorly, you can visualize the sacrum. You can visualize the posterior superior iliac spine. You have the iliac crest, the iliac fossa. You have the promontory at this position. You have the sacrum at this position. You have the ischial spine. You see that here the anterior inferior iliac spine, anterior superior iliac spine are not much more seen in female, because to the roughness of the pelvic bone of the female, it's less than in the male. You have the pubic tubercle. You have the inferior ramus of the pubis. Here is the body of the pubis at this location. Here the ala of the sacrum. So now visualizing posteriorly, we have the superior articular process, you have the sacral canal, we have the posterior sacral foraminals. Here you are going to have the greater sciatic notch separated from the lesser sciatic notch by the ischial spine. The lesser sciatic notch is found somewhere here, and you are going to find the different ligaments are going to, the ligaments that attach this position here and attach this position here are going to be involved now with the formation of the greater sciatic foramen and the lesser sciatic foramen. So here you see you have the coccyx, and this is similar looking to the male, but here the difference is that the roughness is reduced. So now let's visualize now the pelvic bone laterally. So here you are going to have the iliac fossa, the iliac crest, the anterior superior iliac line. You have the arcuate line here posteriorly, and then anteriorly you are going to have the pecten pubis or the pectineal line, so which is formed by the superior pubic rami. You have the pubic tubercle, and here is going to be the pubic crest. So you're going to have the pubic symphysis at this location here. You're going to have the inferior pubic rami here, and here you are going to have the obturator foramen. So here is a lesser sciatic notch which is produced, greater sciatic notch which is produced here, anterior inferior iliac spine. So this is what you can see on the lateral wall of the pelvis of the lateral wall of the pelvis when no muscle have been placed already on it. So this is similar with a male and a female. Just as with the female, the prominence of the ridges are less pronounced. So all the radiographic view, you are not going to see that. So now let's visualize now the connective tissues involved in the pelvic bone or the pelvic girdles. So now the connective tissues now is going to be, you are going to have the bone. This is first the body of the feet vertebrae. Now connecting here to the sacrum, we know that this longitudinal ligament is going to continue from above to anterior to the vertebrae and come down to the sacrum. Here is going to be the anterior longitudinal ligament connecting the lumbar, the feet lumbar vertebrae to the iliac bone of the hip bone is going to be the iliolumbar ligament. Here connecting the lumbar vertebrae, lumbar 5 vertebrae to the sacral bone is going to be iliosacral ligament. Here connecting the sacral bone to the iliac bone, you are going to have the sacroiliac, anterior sacroiliac ligament. So now connecting the ischial spine of the ischium to the sacrum, you are going to have the sacrospinous ligament here. Connecting the ischial tuberosity from the ischium to the sacrum, we are going to have the sacrotuberous ligament. So these are the different ligaments which are going to be involved. Here is going to be pubic tubercle, and inferiorly connecting the sacrum with the coccyx, you are going to have the anterior sacrococcygeal ligament. So from the different bones they are connecting, you can derive their respective names. So now here you are going to have the iliolumbar ligament. This is a sacro-lumbosacral ligament. Here is a zygapophyseal joint with the zygapophyseal ligament. Here you are going to have the supraspinous ligament, which is continuing from the vertebrae above downward. You are going to have the supraspinous ligament here. Here you are going to have the deep posterior connecting the sacral bone to the coccygeal bone. You are going to have the sacrococcygeal ligament, but in this case you have a deep and a superficial sacrococcygeal ligament. So now posteriorly, you can visualize very well now the posterior sacroiliac ligament. So you have the posterior sacroiliac ligaments here, and you can also visualize the sacrospinous ligaments here, which connect the spine of the ischium to the sacral bone. We have also the sacrotuberous ligament, which connect the tuberosity of the ischium to the sacral bone here. So, and also connect slightly with the iliac bone, anterior, the posterior inferior, the posterior superior iliac spine. This is the posterior superior iliac spine, having one of the origin of the sacrotuberous ligament, and also have this one here. So now seeing this with the connective tissue, seeing the lateral view of the pelvic bone, we can visualize this. So the pelvic bone seen laterally, here we have the obturator membrane, here we have the lacunar ligament slightly above the pelvis, here we have the inguinal ligament here. Lacunar ligament and inguinal ligament are lacunar ligament is going to cover part of the spermatic cord. So now we have this, the we have the anterior sacro called sacroiliac ligament here. We have the anterior sacroiliac ligament. We have the anterior surface of the sacrum. Here you're going to have the interosseous sacroiliac ligament. Here you're going to have the posterior sacroiliac ligament. You're going to have the zygapophyseal joint. You have the anterior longitudinal ligament and all this. Here you are going to have your sacrospinous ligament, and here you are going to have the sacrotuberous ligament. So this is the sacrotuberous ligament, and between the sacrotuberous ligament and the sacrospinous ligament, you're going to have the lesser sciatic notch, and between this other portion, you're going to have the greater sciatic notch, which is going to be produced. Because the greater sciatic foramen, initially they were notch, but when there is addition of the ligament, they become foramens. So now, superior view of the pelvic inlet, you have this. You have anteriorly, you are going to have the pubic tubercles. You are going to have the pelvic, the pubic symphysis, the pubic crest. So as you are going to, this is the anterior portion of the pelvic inlet. Laterally, you are going to have the pectineal line. Here you are going to have the arcuate line, and posterior you are going to have the ala of the sacrum. So now with the different the ones here, you have the anterior sacrococcygeal ligaments. Seeing the connective tissue, we have the sacrospinous ligaments here. We have the sacrotuberous ligaments here. You're going to have the anterior longitudinal ligament, which continues from other vertebrae above. You have the body of the vertebrae S1. We have the anterior sacroiliac ligament here. So these are the different views, and this is the anterior superior, anterior inferior iliac spine. From here we realize that this bone, it is less prominent. So from here we see that it is less prominent. So it's the bone of a female pelvis here. So now this is the pelvic inlet, still of a female, with a very large opening. So this is the pelvic inlet. So the pelvic inlet, you have already found the boundaries. Anteriorly you have the pubic symphysis. Here you are going to have the pubic tubercle. Here you are going to have the pectineal line. Here you are going to have the arcuate line, which is formed by the iliopubic eminence. You are going to have posteriorly now the ala of the sacrum as such here. So this is these are the boundaries of the pelvic inlet. So you have the superior pubic rami, you have the pectineal line, you have the iliopubic eminence, you also have the arcuate line here. Here is going to be the iliac fossa, not really at the level of the boundaries, because the pelvic inlet it is much more down than the iliac fossa. So now let's see the pelvic outlet, where the baby comes out during birth. So with the pelvic outlet, what do you realize? You realize that inferiorly, the boundaries anterior will be first the pubic symphysis, with now the inferior pubic ramus. You have the inferior pubic ramus here. So after the inferior pubic, you have the ramus of the ischium. All of that is called the ischiopubic rami. So at this position here, we also have the tuberosity of the ischium. At this position here, you're going to have the sacrotuberous ligaments. So here is going to have posterior, you're going to have the sacrotuberous ligament. Posterolateral, you're going to have the sacrotuberous ligament, and completely posterior, you're going to have the coccyx. So all these are going to show you the boundaries, inferior side of the pelvic outlet. So now you also have laterally to all this, you're going to have the acetabulum. Here you can see the anterior superior iliac spine, anterior inferior iliac spine. You can see the different locations. You have the posterior superior iliac spine, and you have the sacrum here. So these are different parts you can also visualize. So the anterior superior iliac spine and the anterior superior margin of the pubic symphysis, you see that most of the time they are on the same line. So now let's visualize very well again the pelvic. This is the pelvic inlet now in the male. So in the male, see that it's quite different because they are much more roughened. The angle is reduced and the pelvic inlet has reduced in dimension. So this is a male pelvic bone. So now this is, you are going to have a sacral promontory, the ala of the sacrum. You're going to have the sacroiliac joint. So this is similar to the pelvic of the female. So it should not be visualized in much precision. So now let's visualize some visceral content, the general visceral content of the pelvic when you have a sagittal section. So on this sagittal section, you have the general viscera with the sigmoid colon here, the rectum here, and the anus here. Here you are going to have the this is in a male here, so there is no uterus here, so you are going to have the vesi or the bladder here. You are going to have the prostate gland. Here you are going to have the these are going to be muscles, the external urethral sphincter. Here is another, is a bulbo. This is the bulbo, the Cowper's glands or the bulbo urethral gland mostly, or another muscle. They are the bulbo urethral glands here, and this muscle here is the deep perineal muscle. You also have a superficial perineal muscle which is outside here. So continuous here, you are going to have the penis. So at this position, upper part of the bladder, as you can, this is a remnant of the urachus. This is a remnant of the allantois. So this is going to be the urachus found, which is going to form the medial, the median fold at level of the abdomen. So you are going to have a certain median fold at level of abdomen, deeply at level of abdomen. You have the bladder here. You have the symphysis pubis. You have the retropubic pouch. This is a potential space now, which is used for when the bladder wants to enlarge. You have the suspension ligament of the penis. Here you are going to have the prostate. Here you are going to have the membranous urethra here. Here you see that the penis is going to consist mainly, the bulk of the penis consists mainly of two parts. You have the corpus cavernosum, which is this part here, and we have the corpus spongiosum. The corpus spongiosum is a part which is much more excitable compared to corpus cavernosum. Corpus cavernosum is what is going to much more produce the thickness of the penis when someone is excited. Why? The one which is much more containing peripheral nerves for excitation are the glands and the lower part of the penis, which is involved with which has the bulk of the corpus spongiosum. The corpus spongiosum, again, you have the penile urethra here, or the spongy urethra. So you have this here. So now these are the testes found here. So at the level of anus, you can see the superficial part of the anal sphincter. You have the middle part and you have the deep part of the anal sphincter. So now we see this part separating the bladder or the vesi. So the bladder can be called also the vesi. So you have the retrovesical pouch separating the bladder from the rectum. So we have the rectovesical pouch here. So these are different parts. Now, and the arterial supply, you need to know that arterial supply in the pelvis comes much more from the internal iliac artery, and the venous drainage is mainly taken by the internal iliac vein. So as you are going to see in the later views. Now, the general section in the females need to know that the female instead consists of the uterus, and there is no penis. So what's going to happen is that you still have the urachus. Here you have the bladder you have your bladder, or still called this is the bladder, or still called the vesi. You have the pubic symphysis at this location. You have the urethra here. You have the glands of the clitoris. Here you have the labia minus. In case of the lower part, you were instead having the scrotum. Here you have the labia minus and labia majus. Here labia minus and labia majus. Labia major. Here you are going to have the external urethral sphincter located at this position here, in the deep perineal pouch. So this is the urethra, which is going to descend here. The vagina is going to the genital system in female is going to be separated from the urinary system. Here you are going to have the vagina opening, so with the vaginal orifice here. In a virgin woman, you're going to find the hymen at this location here. So you are going to find this opening to the vagina. You have this external os of the uterus. Here you are going to have the cervix of the uterus here, and the cervix of the uterus. Here is the anterior fornix, here is the posterior fornix, here is the body of the uterus. So you have this different location. These are the uterine. This is the uterine tube, and here is the ovary. The ovary has two ligaments which mainly maintain it. You have the suspension ligaments, which are containing. The ovary has mainly two ligaments. So this one is a suspension ligament, which is going to maintain the ovary. So we have this suspensory ligament which contains the ovarian blood vessel, and also have the broad ligament of the ovary. So we have the broad ligament of the ovary somewhere here. Now we need to know that the uterus has a ligament which is two ligaments which are also maintaining it. We have the round ligament of the uterus located here, and we also have the broad ligament of the ovaries which are used to maintain the uterus in this position. So now we have the sigmoid colon. So you see that this pouch will separate now the uterus from the vesi or the bladder. Is going to be called the utero-vesical pouch or the vesico-uteral pouch. So this is a vesico-uterine pouch. Now this pouch separating the rectum from the uterus is going to be the recto-ureterine pouch, or the recto-uterine pouch. It also have another name called the pouch of Douglas. So these are the two names that can be given. So now you have the external os of the uterus here. Here you are going to have the levator animus, which forms the posterior wall of the pelvis. So posterior inferior wall of the pelvis. So here you are going to have the rectum, the deep part of the external anal sphincter. So we have when in a heterosexual individual, all these anal sphincter have problems. So the deep part and the superficial part of the anal sphincter have problems. This is why these people are not easily capable of maintaining physics in their rectum, in their anal canal. So at this level we are going to have the anal canal here. So this is the anal canal descending. So now let's visualize now the wall of the different pelvic wall. So we have already visualized the different bones which are located here, and internally we said that there was a pubis, there was the ilium above here, and here the ischium formed by the ischial spine. So now we need to put in mind that the muscle which is going to attach at this location here is going to be the obturator internus. So the obturator internus is going to attach at this particular location here. So after the attachment of the obturator internus, you also have the piriformis muscle which attach at this position here. So you have the obturator internus here, you have the piriformis muscles here. So now this is the obturator internus, which has the origin from the level of the obturator membrane, and also have its origin from this other part of the ilium here. So it's going to descend posteriorly, and it's going to have the posterior fibers to this position here on the trochanter, or to this position here of the trochanter. Now the piriformis has its origin from the different anterior part of the sacrum to this position here on the greater trochanter. So these are the different muscles which form the lateral wall of the pelvis. So the muscles form the lateral wall of the pelvis. We have the obturator internus and we have the piriformis. And again, the piriformis is a very good landmark because it's going to separate the greater sciatic foramen into two parts, a superior part and an inferior part. All the structures like the venous supply which passes through the superior part, they are going to be having a name superior. Example, the superior gluteal artery. All the venous and arterial supply which are passing inferior, they are going to have a name inferior. So example, inferior gluteal artery, inferior gluteal vein. So this is what you can visualize now on this section here. So here you are going to have the posterior superior iliac spine. Here you are going to have the anterior superior iliac spine. Here you are going to have the obturator internus and all that, forming the lateral wall of the pelvis. Now posteriorly we can see how the fibers are moving now to this posterior part now. In the lower limb, you need to know that there is a quadratus femoris located at this position, connecting this part to the lesser trochanter. And we also have the gemelli superior and the gemelli inferior, which are having their origin at this position of the ischial tuberosity and ischium bone. So this intertrochanteric crest posteriorly here. Now, after having the obturator after placing the piriformis and the obturator internus muscle, now there's the muscles of the inferior abdominal wall, the inferior pelvic wall, which should be added. That muscle of the inferior pelvic wall is consisting of three different muscles. So it's going to be called the levator ani muscles. So the levator ani muscle is going to have its origin. From all this part here. So we have the origin of levator ani muscles from the coccyx to this portion here. So levator ani muscles, you have origin from the coccyx here, and it's going to move anteriorly to this different position here. So you have the levator ani muscle. So the levator ani muscle is made up of three main muscles. You have this first muscle here, which is going to be the puborectalis. The next muscle here is going to be the iliococcygeus, because it starts from the coccyx and then comes to the level of the ilium and attached to the tendinous arc here. Tendinous arc is formed by the ramifications of the obturator fascia here, because above the obturator muscle you have the obturator fascia. The ramification of obturator fascia produces the tendinous arc. All of these are going to start from the coccyx to and terminate at this position of the tendinous arc and then the ilium. So that's why it's called the iliococcygeus muscle, part of the levator ani. We also have this other muscle at this position here called the ischiococcygeus. We have the puborectalis, one of the muscles. We have the pubococcygeus and we have the iliococcygeus. These are the three muscles which mainly make up the levator ani. The ischiococcygeus is not part of the levator ani. We have the ischiococcygeus here, or also called the coccygeus. So this is a puborectalis which goes to this position as such here, and these are the different hiatus we have formed. We have this hiatus formed here called the urogenital hiatus, and here we have the anal aperture. Now, inferior section here, you can visualize the pubic symphysis. You have the urogenital hiatus, you have the anal aperture, you have the tendinous arc here, and here we have the anococcygeal ligament. So inferiorly, you can visualize well the other muscle called the pubococcygeus muscle. You can also visualize the other muscle, the puborectalis. So we have the obturator canal here. We also have the obturator internus. The fascia is not covering here below, but only covering above. The obturator fascia is only covering above but not below. Here you have the iliococcygeus. The iliococcygeus here is another part of the levator ani. You have the anococcygeal ligament, one of the origin sites of the levator ani with the coccyx. So here we have the ischiococcygeus is not part of the levator ani, and we have the piriformis here posteriorly. So this is when you can visualize from top. So when you visualize the muscle from top, you can visualize it as such here. So from here, it marks the end of the first part of our tutorial on pelvis and perineum. Thanks for your kind attention. Please don't forget to like and subscribe for science video makers. Thank you.